Chan?
We are recording now.
Okay. Hi everyone, since our time is important to us these days, I will dive straight into the session. And I'd like to start, welcoming everybody from my side as well. And I'm looking at the names on call, and I can see there are lots of individuals who've been in the sector for a long time. So the topics of risk management and screening are pretty much well known to the audience today. But what we want to do with our call today is it's not a training session, but as it has been during the past two sessions, it's a peer-to-peer knowledge sharing, and where we would also share our expertise and our knowledge from our side too. So please, when time is given to engage, we really appreciate you chipping in with what you've done from your side in the organization and what you think that we should be doing as well. So I'd like to start by, I'm going to take this slide later on as well, but I want to put it out there as an overview of what our call is going to be today. It's about risk and screening. And onto the right-hand side, you can see the 10 steps of screening. I'm not going to be talking about each step, but we are going to discuss on how have we adapted these steps to the current situation. And on the left-hand side, the practical applications of screening. And you can see it's covering risk management, the risk assessment, as well as what do we do with our position descriptions. And Robert is going to be discussing a little bit more on that. And the topic about police records checks, and also in today's situation, how can we welcome new methods of carrying out the steps. For example, video interviews and e-references. And in the center, you can see that those are the legal applications or the legislations and the human rights related, the legal profile that comes into when we are screening. I can hear my own feedback, and that's maybe through somebody else's phone. If you all could mute until it's time for you to speak, I'll appreciate that. So the first question that I've been asked about, and that had come through our minds as well as the informal conversations, is about risk and how do we handle the risk with our screening steps. If you're looking at, because when it comes to risk during this COVID-19 pandemic period, there are three questions that I assume that all of us will be having in our minds. One is the risk of sending a stranger to a client's home, and the other one is the vice versa, where you're sending a volunteer to a stranger's home. And also we will have questions about how do we prevent the risk of spread, and next, how should we make sure that we are legally accountable to the risk management practices and the steps of screening. So if you look at the left hand side, you can see a few questions that you can ask yourself, because right now it's a different time when it comes to risk management. There are emergency services, our service delivery is adapted to the situation, but still the risk does not go away. The risk is there. So when we're looking at, should we have a police reference check? What do we do when we are recruiting volunteers? Those 4 questions on the left hand side is something that you can consider. Next is, how do we mitigate the risk? How do we manage the risk? So I will give you the acronym REST. You identify what could go wrong and see whether you can rest at ease by either reducing the risk that you have, eliminating the risk, or putting safeguards, or even transferring the risks. I think the acronym REST will be very much in use with our day-to-day work, because we are maybe changing policies, or we may be retweaking the policies we have, or enhancing the operational side of it based on these 4 ways of managing risk. So with the risk, I'm going into screening steps. And if you look at the 10 steps of screening, it does go from 1 to 10, but there are things that we can do to change and how we apply those 10 steps. It need not go in step 1 to 10. But I think when we're trying to manage risk and trying to apply the 10 steps of screening, the foundational principle that all of us should be remaining with is the duty of due diligence. And with that comes the duty of care and the standard of care. Because there are times, even us, sometimes we think, okay, how do we handle the risk? What are the screening steps that we want to bring in when it comes to recruitment? And what is that magic formula? I think because of the public health crisis, there is no magic formula, but to go back to the basics that Volunteer Canada has recommended to us. And I really like that these 10 steps can be used in many different ways, even in today's context. But I think the foundation is the duty of due diligence, the duty of care, and standard of care. If we apply that lens, I feel that we are able to get answers to the questions that we may have when we want to think of a volunteer engagement strategy at this time. Another question that we may come across is police reference checks, and I want to give a small update with our research. Whether our risk management and your organization decides yes, a police reference check is required, what we have at hand today is both for folks in Caledon and folks with Ontario Provincial Police and folks in Mississauga Brampton with Peel Regional Police. They both have a limited service way of delivering their services. I spoke with the Peel Regional Police, their records line today, just to clarify as to, if a police records check is required, what should organizations or volunteers do? What they said is they remain within issuing a police record. Well, their department is closed for in-person services, and they do need individuals to come in person when they require police reference checks. And the reference checks are issued only when it comes to essential services when it comes to our sector, essential services that are required in direct connection with the COVID-19 pandemic and the work that we do to manage the pandemic with our organization's service delivery. Individuals do need to come in person, but unlike earlier where you can just walk in, now it's based on a prior appointment basis. So that's an update that I have. I was unable to get a call of OPP, but in their website, you can see that they do say that the services are limited and based on emergency needs. So in the next slides, I'm going to open it up to Robert to share on what can be done to sort of adapt the position descriptions. But before we get there, I open the call to individuals in the forum to share on how they have adapted the screening steps. Is there anybody who would like to join and let us know with what enhancements you've done?
Hi, it's Derek, City of Mississauga. Can you hear me?
Yes, Derek.
Yes.
Hi, we've basically eliminated, we don't have any emergency. We have emergency services, but not where I deal with for the volunteers. So obviously the fire and everything's running. So we've eliminated the risk because our positions are non-essential. Like ours are programming mostly. Volunteers help out with programs, events, and different things of those kind of natures. So we've eliminated the risk. I know that's not the case for everyone, so that's an easy answer for me. But that's what we've done because we don't have. For us, it's not worth the risk. For the types of services that we offer. Again, we're not delivering food to shut-ins. We do have a library program where they deliver books to people, and not that their mental health isn't important, but it's just as risky for the volunteers to be dropping off the books to someone, and that's completely a little bit different than providing food and services to somebody who needs it. So in our case, that's what we've decided to do.
Thank you, Derek. Is there anybody else who would like to share what they've done and how they've changed?
Derek, can I ask a question? It's Corrine from Volunteer MBC. I was wondering, and this applies for Brampton as well, and as well if someone's on the line from Caledon. because your regular volunteers are already, have already had a screening process and have undergone that extensively, would there be an opportunity for Volunteer MBC to share the current COVID-19 community responder position with those volunteers so that they can potentially help out other organizations that do need volunteers at this time?
Hi, my name is Allison and I'm with the town of Caledon.
Hi, Allison.
Hi, Allison.
Hi. Currently, we haven't had any opportunities for volunteers, so this might be something for people that are already onboarded and gone through the process, that this might be something that's available. So maybe after the meeting or something, somebody could reach out either by email and tell us what opportunities are available, because I know there are people wanting to do things in the community and wanting to help out that have already completed the process.
Right. Thank you very much, Allison. Well, if you can put your email address in the chat box, that would be great. And we'll send the position to you. Because, well, I myself live in Caledon, and I've seen a lot of, caremongering groups and coming up, and we're just at Volunteer MBC and across Canada, all the volunteer centers had a discussion about this topic yesterday, and we're just very concerned that, these are potentially strangers going into the homes of strangers, and we would much rather that they are vetted and go through organizations that already provide a form of these services today, right? So that's why I asked the question of Derek and Brampton as well. Is there a way that, we know that the need is out there, especially right now in Brampton and Mississauga. Is there a way for those volunteers to at least get to know about the opportunity so that we can potentially refer them?
Yeah, I believe we can do that at the City of Mississauga. It's Derek again, sorry. I've already been through our, we have a city email for the volunteers, and of course I'm in charge of that. So whenever I get any requests, I actually forward them on to Volunteer MBC and give them the link to the page where you have the volunteer opportunity. So I've already done that right now. I have been speaking to my manager, my manager's manager, to see what we can do. And of course, after this meeting and any subsequent conversations that we have, I may just put a direct link on the webpage. We already have a link to Volunteer MBC, but I might be able to get that changed and just say these are the types of opportunities that are available. And maybe we come up with some kind of wording so that people do understand the risk, because part of the concern that I have, and again, it's not with Volunteer MBC, but there are different groups that are popping up that want to do things, and they want to do them for the right reasons, but they maybe don't have the experience that some of us have, or the people they can just check with or
Right.
talk to about advice to know the risks for eliminating some of those things. And so if they're vetted through Volunteer MBC, who I'm certainly comfortable with, knowing that you're not going to take organization, you're not going to be sending our volunteers, let's say, out to organizations who aren't taking the proper steps, then that's fine. But we, of course, I don't want to just be giving this information out to just say, oh, go help this organization and go help that. So as it pertains the way you've done it, Karine and Shaminda, I'm fine with that. It's just a matter of exactly what we say. And if you're okay with putting permission, we can probably put something up in messages or on our websites in some way to make that statement so people know. So I have been doing it sort of unofficially through direct response when I get the questions for people wanting to help with COVID-19. But I haven't done it on a larger scale, and I'm willing to help with that as best I can. And I, of course, have to seek permission, but I've already got permission to get the process going.
Oh, that's wonderful. Thank you so much, Derek.
You're welcome.
Thank you, Allison, for sharing your email. Thank you so much.
Yeah,
no worries at all.
And also, Derek, by all means, do share that message. Put that statement. We will ask our colleague Sean, who's on the call, to sort of work with you for the particular, the blurb itself. But yeah, because this is now it's a good segue for what I wanted to speak about next. Because especially when it comes to caremongering groups, I think sometimes we may be in a tough position in trying to get them to realize the risks involved and what does risk management mean, because the general tendency for organizations like that to think about is going through processes and processes of things in a time when emergency services or emergency action is required. But that doesn't mean that risk is not there. The risk is certainly there. So I think, in my personal opinion, it would be better, and it would be a better approach for us to go with helping them understand on how to apply this REST acronym. Because when you are like, what we've done is just like Corinne mentioned, with the community responder position, is mainly to help to direct the volunteers to organizations that do have the risk management practices in place and who knows what volunteer engagement is about, so that the volunteer who's applying to that position knows that that they are being directed to a safer organization, and organizations know that we have made sure that the volunteers understand that when they come to the organization, or when they're directed to the organization. And also helping them apply the REST acronym is mainly the safeguards. If you're visiting someone, and if that is absolutely necessary, okay, then how do you handle the stopping the spread, related risks? What are the safeguards you have in place to make sure that you are safe as the volunteer or the self-organized group, and the people you're helping are also safe in eliminate or reducing the spread. And at the same time, you do have to look at the human rights aspect of it as well. When you're taking information from individuals, you may be using online tools, you may be using quick systems and tools to bring in people's information, but are you protecting that information while you're doing that? Because no matter however much we all go into trying to help one another, but we have to also understand that there could be individuals who want to use this opportunity to do harm as well. So how are you protecting your digital data? Of course, eliminating risk is if you're suspending all services. And then how do you reduce risk? Can you partner with, like, can they be the front end of advocating for the good work that the not-for-profit organizations are, like our social purpose organizations, do, and partner with those organizations to deliver the service, thereby being a group that is expanding the capacity of the not-for-profits and charities that are already in action during the COVID-19 period. So thank you very much, everyone, for sharing that. And next, before I open out to Robert, a few suggestions that we have been discussing within Volunteer MBC, especially when it comes to the order of how you take the 10 steps of screening. There are a few. Sorry, it's automatically doing that. Are we on the screen, everyone? Corinne? Sean?
Yes, you are.
Yes, yes.
Orientation and training is at number 8, but I think this time we can push orientation and training during the application process as well. You can put out your partial, maybe the orientation or the partial training before individuals go through the full onboarding process, or during the full onboarding process. And at the same time, when you want to conduct your interviews, if you are an organization who's been traditionally conducting the interviews as a one-on-one basis, maybe now is a good time to explore how video interviews can be leveraged within your organization. Tools such as Skype, and also Microsoft Teams now is free for up to 300 participants at a time. With a limited service. Microsoft Teams is a video conferencing and a chat-based tool. The only difference between the paid version and the non-paid version is in the paid version there is no calendar for us to work with, but you can certainly initiate a call as a video call and have that interview going from person to person. And I know our sector is quite used to e-reference checks, where you're sending the reference checks forms via email and having individuals respond. Because time is of essence to everyone, even though it is possible to make a call, maybe even the e-reference checks are also a faster way of getting things done. But the main thing is to, whatever the changes you've made to your onboarding process, your recruitment, and your interview processes, your training, is to communicate and be transparent of how it's done. Because right now, people may not have the opportunity to, ask that in person, a question in person to clarify for themselves. And at the same time, if everybody starts calling, your time is important. You are also engaged in a lot of work that the organization does, so maybe you wouldn't have time to answer phone calls. So use all the channels you have, be transparent, be clear, and communicate as much as you can. And as an ending note from my side, when it comes to, should we have a police reference check, what screening steps do we apply? I'm going back to the basics that Volunteer Canada had recommended to us. Simply apply the duty of due diligence, and with that comes duty of care, standard of care. Said in short, have we done everything possible from our side, from within the capacities that we have, to make sure that we are screening in the right volunteer, because we do understand the risks involved. And while you do that, a caution is to make sure whatever the enhancements, changes, and tweaks you make to your process, that it's position-based and not focused on people-based. So you look at the position, what does a position require, and how do we handle the screening steps, or how do we tweak the order, or how some of them may apply, some of them may not. And how do we apply duty of care, standard of care, to do our due diligence. So we can have a deeper discussion, and we do have a segment for you to ask our questions. But before that, I hand over to Robert, who will talk about, when it comes to drafting your position description, what can you do to adapt to the crisis that we have at hand? Robert, over to you.
Thank you, Shaminda. Yes, that's a very important aspect of, shall we say, getting your organization involved in the needs of COVID-19. And it's not just limited to that, but the first thing, the first area that I think needs to be addressed is needs assessment. And fundamentally, you can divide it into two different considerations. Number one, have you got a position, a volunteer position right now, or a role that can continue and yet be adapted or refocused so that it concentrates almost exclusively on virtual or telephone connections with the people that you serve by your volunteers? And an easy example that just recently was posted on our website was an agency that it's involved with families, and it has had a position that traditionally involved personal meetings as well as weekly meetings over the phone. But this organization quite cleverly recognized that during COVID-19, if it refocused the content of its position, and it didn't take much to do it, it basically went almost completely virtual. So it has the advantage of keeping its volunteers current, who are current. If they can adapt with the position, they will continue, but also it does not interrupt the recruitment process or the recruitment cycle. And as Shaminda said, obviously, screening is going to take on quite a different character during COVID-19, but that agency is also looking very closely at making the necessary modifications. On the other hand, the second aspect or the second consideration is if you have, shall we say, a certain segment of the population, particularly, for example, seniors or people who are vulnerable in terms of access to resources, particularly food, maybe even shelter. Is it necessary for you to actually create a new position or a distinct role in order to fit it into the COVID-19 mosaic of answering or responding to needs? And the example that just was posted this morning on our website involves a local food bank that carried on its services essentially as an outreach, that is delivery of food to the people it serves. And in that respect, they recognized that they need an infusion of volunteers. So what we did is we created a general COVID volunteer help volunteer position. And hopefully that will answer their immediate emergency need. But I want to point out a couple of things and going on to item 2, which is adapting the role design. When I say, for example, general COVID-19 volunteer help, that points directly to the need to have your role or your volunteer position identify COVID-19 as part of the, or even the principal reason for that role to be in existence. So you should state that right in the position title in terms of the position that you may need to create. Also, it's very helpful. For example, going back to the agency that's gone virtual on at least one of their positions, they have modified their position title and they talk about virtual/telephone connection in the short term. And they also recognize COVID-19. So the member of the public or an aspiring volunteer or even experienced volunteer, when they see that position title, they immediately are focused. They immediately know what it's for, okay? That also goes to clarity in the position description. I'm sure most of you are familiar with the general sort of layout or format of our volunteer positions that are created through Volunteer Attract. Some roles have to be revised in terms of their descriptions, in terms of emphasizing again the virtual or telephone connections and how capable you are of having volunteers accomplish those. And again, dovetailing in what Shaminda said, in terms of orientation and training and position qualifications, you may very well need to address directly the screening processes by which you intend to onboard or at least consider a volunteer. The key for this is confidence. You are creating confidence in a moment of, for all intents and purposes, crisis. A person who's looking at these positions wants to know, wants to be confident. They want to be confident that they can go to that position. They can apply through Volunteer NBC or even telephone or email the organization. First of all, they'll get a response. Secondly, that they won't be wasting their time. The interesting thing here too is you don't necessarily have to stand down all your volunteer positions during COVID-19. That's a bit of an aside, but I sometimes see positions that involve virtual volunteering. They're not related to COVID-19, but there's no reason why they can't continue. The other aspect of this is, in terms of volunteer recruitment, there's no real rhyme nor reason why certain positions cannot continue to be capable of recruitment, or if you're not recruiting, certainly stepping back with them and reevaluating them if you have the time to improve them for when we come out of this emergency. And the fourth point, reset and promote access points. This is very important because one of the most frustrating things a volunteer can encounter is attempts to get a hold of the organization, and they run into a blind alley. Whether there's been a succession of personnel or reassignments during the COVID-19 emergency, a volunteer doesn't want to delay or waste their time going into a blind alley in terms of trying to get a hold of people that matter within the organization. So this is a nice way of saying to members and all stakeholders, review your contact points, review the names and contact information, telephone numbers, email addresses, and so forth. Sometimes you might even want to create a dedicated email address for example, or a dedicated phone number for your involvement in COVID-19. But not to do that, you suddenly wake up one morning and say, well, why aren't we getting a response? Well, we're not getting a response because again, people aren't being able to connect to us. So as I say, the key here is confidence, but also you have to first identify and focus on the COVID-19 need and the COVID-19 positions that can work with respect to your volunteering and making all important connections and assistance within the community. Okay, back to you, Shaminda.
Thank you, Robert. And I would continue to talk about how we have, thought about supporting the organizations who want to sort of respond to the situation at hand, while you're adapting your positions to the crisis. We also have, in trying to mitigate, self-organized groups overlooking the risk. We also have, come out with a free one-time 90-day subscription to new organizations. I mean, we're trying to do our part as well to make sure that risk management is in place, and also the the groups are supported, and at the same time that we become the conduit to for knowledge sharing, as well as volunteerism within the region of Peel. So we have introduced a free one-time 90-day subscription to our online volunteer referral system. And if you have an organization who you think might benefit from it, or if you are an organization on call who's not a member of Volunteer MBC as yet, please send us an email with your interest to membership@volunteermbc.org, and our colleague Nadia Lake will be looking at those requests and directing them to us for the due process. And again, that's a free one-time 90-day subscription to new organizations, to our online referral service. Okay, so with that, I open it out to the forum to have a discussion and also for peer-to-peer sharing, mainly to answer two questions. One is, like I asked before, if you have an aha moment, if you can share again, how have you adopted the 10 steps of screening based on your risk assessments? Or to discuss about what supports or resources you need from us as a volunteer center to help you with volunteer engagement, to mitigate risks and also to figure out the 10 steps of screening. On the right hand side, you have the 10 steps, but I do open it out to the forum. And to take us through this particular segment, I invite my colleague Madhuri Pedipati, who's our community connections coordinator, mainly operating via our center in Mississauga. Madhuri, do we have any statements, questions in the chat?
Yes, Shaminda. Hello, everybody. The first question is from Chandra. Thank you, Chandra, from Region of Peel. Chandra's question is that she's relying on our support. That means from Allison, Derek, and Volunteer MBC team for requests that come through public health, long-term care, paramedic services, and community service. Perhaps they're looking to come up with a process with the Volunteer MBC so that they can avoid the duplication of efforts that have been given maybe an overlap of requests that Volunteer NBC and Region of Peel may be getting.
Certainly, Chandra, that I mean, right now, collaboration is the way to go because we're all trying to, one, share the workload, share the expertise, and to make sure that the community is the central focus. So thank you very much, Chandra, and we will be happy to sort of, either be the mediator or be the lead organization, or however our partnership may be, to be on top of that and to see how we can honor your request. Corinne, do you have anything to add to that?
Sorry. Yes, I think, thank you so much for bringing that up, Chandra. It kind of goes a little bit to my point from earlier. We would love to work with the municipalities in the region more closely to make sure that we are able to take care of as many people as possible. Because to be honest, right now, because we created that COVID-19 community responder position, we're getting so much interest from the community wanting to help. And we, as Robert had indicated, we just need to make sure that organizations are starting to think about the different positions that they could modify, and also I think, looking for those needs in the community. It's been really helpful for me to be on the Region of Peel calls where I hear from food banks that are really struggling right now, that really desperately need volunteers to help out. Even Meals on Wheels type of services, where a lot of the volunteers themselves are now vulnerable because they are often seniors that are now being asked to stay at home. So how can we support them by still being able to give them drivers that have been screened and that we can send to them? So we would love to, as Shaminda had pointed out, be that conduit to make that happen.
Hi, it's Derek again from City of Mississauga. Sorry, Shaminda and Corinne. I'm just trying not to lose my thoughts. I think that would be great. And to Chandra's point about duplication, I would prefer, I'm speaking for myself, but also from our organization, and I think they would agree that I would prefer just to be referring to one location as to multiple. So if you were the conduit for Peel, for Chandra's organization, for example, or for the food banks, I think that would be better. One, so we don't miss organizations, because I'm not as familiar with yourselves with all the sort of legitimate organizations, I will say. I know a lot of them, of course, but it would be a lot easier to refer to one area, and then through things like Robert's mentioned, like in the position description, if it says if it's for Peel Health, or if it says it's for the food bank in the position descriptions that say COVID-19, Peel Health, or food bank, or whatever the organization happens to be, I think that would be very agreeable, because that way it's going, you're sending the volunteer and they know which organization they will be volunteering for. And my other point is that we also probably can't, I mean, we can try, but we maybe can't confirm who these organizations are getting. If we get the message out to our volunteers, they may pass the message on to friends or family who want to help, which is great, of course. But also some of our volunteer positions, or most of ours, may not have the level of screening that you need for the higher risk positions, or the more needy positions, I guess, is what I'm thinking about. Because a lot of the positions, yes, you can do virtual things like Robert was saying, but if it's delivering food and things like that, the very basic essential services, if people want to help out for that, I think it needs to be known through the position description, which I think is great, letting people know, but the client also has to know that everybody's at risk, sort of a thing. So as Shaminda was saying, if you take steps like, maybe when you knock on the door, the client knows that the person dropping off the food, for example, is going to be 5 feet away when they answer the door, and they're not to let people in, those types of things, which most people probably have in place anyways.
Yeah. Thank you, Derek.
Those are really good points.
Hi. Sorry, Guy, I'm going to take one more question before we go to next to you. This question is from Andrea. Andrea is asking us, has anybody heard about school or school boards, how they're handling the 40 hours requirement by students? and if there is any flexibility on the numbers, that how they are going to take going forward, since there's not many places that these students can go and volunteer.
Hi,
I can speak. Oh, go ahead, Derek.
Sorry, I was just going to say I've been speaking with one of the school boards before this a few weeks ago on this thing, and we were willing to explore giving volunteers, for example, through March break who were scheduled, giving them their hours if the school would accept them. They said they would get back to me. Now, of course, all of this has happened, so I don't really have access to that person at the time. But that's how we had started looking at exploring that.
Okay, thank you.
Yeah, this is Sean from Volunteer NBC. So I deal with some of the schools with our youth programming. So from the teachers that I've talked to, actually specifically the guidance counselors at some of the schools, they've been instructed, that they for any of their students, for any of their needs, they're simply having to adapt. A lot has been put onto the teachers themselves to assess, when it comes to the school curriculum requirements as far as what a student needs to complete their school year, their online learning. A lot has been put onto the teachers themselves to determine, does my student have access to a computer and a quality internet connection to participate in these Zoom calls? So they're doing some kind of like environmental scan in a format where they're trying to, in their individual classrooms, establish what students are able to do and are not able to do. So with respect to the 40 hours, my understanding is it's very much the same in that they're attempting their best to accommodate, but they're being really understanding as far as the fact that the opportunities are not going to be out there, and in this crisis, I don't think it's going to affect the graduation requirement piece for the students. They'll probably be given some kind of it'll either be waived or deferred for those who don't meet it by the end of June. But I think in many ways, a lot of the requirements are relaxed from that standpoint. But as far as students who do want to volunteer and are interested, I've had a lot of students contact us directly from our program saying, well, actually at the beginning when they had a day or two off, they were excited, this is off, and then they realized this is a really big crisis and it's going to be an extended period that they were out of school. Then it sort of set in that, what am I going to do with all my time? So lots of students are coming to us wanting to get involved virtually. And so we're trying to create some opportunities for that, and we'll continue to do that if you know of students who are coming to you from your youth programs and so forth. Maybe young volunteers who had just started volunteering and didn't quite get to the 40 hours, especially those who are in grade 12. They're worried about it and they want to get engaged. They can connect with us through our community responder position. The second thing to that, which I want to add, is simply that we are in the process of, while we recruit people for the community responder position, what we've been doing has been sending them, or rather when they apply, if they go through a process of completing an emergency readiness survey, starts to get a sense of who is this person, and then they're also offered to do the super skill survey. So it's all on our versus COVID-19 page, but I'll plug the link into the survey into the chat for anybody who wants to go through it. If you wish, you can send any of your volunteers to take the survey, regardless of whether they're interested in becoming a community responder right now. They may be interested in sort of indexing those skills and so forth, and if there are opportunities that line up with their skills, then we can certainly reach out to them. But the thing is that it's really important that we understand that the way that this is affecting youth, both in terms of their education as well as their sense of control, which that's one of the major things that for youth is they have a lack of sense of control over situations, and in this situation, very few of us have a sense of control. So it's important to give them ways in which that they can do something, and taking the survey might be a good start for many organizations to send the emergency readiness survey, and gives them a chance to think about what they can do, and they may come up with some ideas, because we may be relying soon on a lot of people in the community to think, wait, what can we do to adapt to the situation while it persists and for future emergencies. So that's what I want to say, and the link to the survey is in the chat now.
Okay,
Thank you. Hi,
Can I chime in here for a moment? It's Robert. I just posted the link to our website with respect to the general COVID-19 volunteer help position and I recommend it as a as a template for some organizations. But there's one aspect, sort of following what Derek said, that I want to emphasize. In the position description for that posting, there's an unequivocal statement that the organization is following government at least requirements in terms of physical social distancing and COVID-19, and also in terms of qualifications. The volunteer who applies for this position is expected to strictly adhere to the rules. So I think that in some respects goes a little bit of a way to not only create confidence in the volunteer, but to look at the risk management aspect of it and say, we're very much aware of it, and so should you be.
Thank you, Robert. And Gaia, over to you.
Yes.
Hello?
Hi, Gaia, please go ahead.
Yes, hi. I have to tell everybody that this is Gaia from Rotary Club Mississauga Malton. I had to suspend all my programming because of this COVID-19 outbreak. So we had to shut down our physical location for the time being because of government orders, but I'm still working remotely from home. What I'm trying to do now, because of the switch of the programs, I'm still engaging the volunteers as much as I can with some of our, like the online training aspect. And plus, since it's working with kids for the coding, I'm asking the volunteer resource parents they can use at home to train the kids before they come to class. So that's what I'm trying to do as for engagement. But soon as we are clear of everything in Peel, we're hoping to wrap and with our coding programs to continue. And as for STEM, we are on hold as well because of the school closure. But as for engagement and everything, like I'm doing everything virtually, and I kind of stopped hiring. Your solution is a bit clear.
Sorry, we can't hear you.
Can you hear me now?
Yes.
Yes.
Okay. So what I've done, according to the government guidelines, I had to shut down my operation physically, but I am working remotely. But I'm still in a position to engage with the volunteers that I've hired for the coding and STEM program, which is we are doing online training, and plus we are giving resources to parents to use for the time being before the classes start. And once the situation is clear in Peel, we can be up and running our programs again.
Okay.
Awesome, Gaia. Thank you very much for sharing.
Thank you.
That's pretty much in the chat box, I think. Over to you, Shaminder.
Thank you, Madhuri. So I'm going to summarize what we discussed before I hand over to Corinne for the close. I think when it comes to volunteer engagement during a public health crisis or during a crisis period, is mainly stemming from the risk management aspect, especially when it comes to a public health crisis. The questions that may be running in our minds would be, as leaders or volunteers, is the risk of sending a stranger to a stranger's home, because for both parties will be vulnerable unless we carry out our proper risk assessment and screening practices. And the second question is, how do we, in today's context, how do we prevent, how do we not contribute to the risk of the spread? And then also, how are we making sure that we are legally liable or legally accountable to make sure that we are providing a safe environment for the volunteer as well as the clientele that we are serving. And in trying to figure out those the answers to that, our suggestion is, and we've heard this over and over again over all the calls, nationally and internationally during this period. It's mainly to go back to basics. I think the 10 steps of screening and the risk management, also as it is recommended by Volunteer Canada, is all the more important right now. Like its value is coming up over and over again, as we have our discussions. But to us as leaders of volunteers, it's a matter of making sure that we apply the lens of due diligence, practicing, the duty of care and the standard of care. In short, having our checklist, our personal checklist as to are we doing or what should we do to make sure that we've done our part, taking every detail into consideration, and then how do we tweak the 10 steps of screening, the order or the application of one or the other, because even when it comes to police records checks, I know there are times where my peers from the sector have said sometimes we know that it should not be a blanket request of a police records checks, but the direction we receive from our supervisors or our organizational decision makers is that everybody needs one. So this is the time for the volunteer engagement practitioners, the leaders of volunteers, to really show the value of volunteer engagement within the organization. So in short, today's call is all about simply remain within the duty of due diligence, and make use of the recommendations that has been given by Volunteer Canada, the 10 steps of screening. And also remember that Volunteer MBC is here to talk about collaborations. How do we, help each other out? We've done two things that we've immediately done, as we mentioned today during the call, is that the community responder volunteer position, so that we take a little bit of the assessment as to which volunteer should go where rather than the system deciding it. And at the same time, to help organizations or even self-organized groups, right, the caremongering groups, we've offered the 90-day, the free one-time 90-day subscription to our online volunteer referral system, to help them recruit volunteers and do the good work that you're doing right now, because we're all out there to help the community. With that, Corinne, I hand over.
Shaminda, can I just jump in quickly to say it's worth mentioning also that one thing that, since touching on what Gaia said, which is that training, if organizations are developing any training, that Volunteer MBC does help you support the development of your own training for volunteer engagement. So if you have training that you do normally in person and you'd like to turn it into an online training at this time, this could be a time to explore that so they can connect with you, Shaminda, and do that, right?
Certainly. And here are the places that you can, our access points specifically for this period. And if you want to know anything about, training related, or even, trying to get information about volunteer engagement, please do reach out to me through training@volunteermbc.org. If you are an organization who benefit from the 90-day, subscription, or of an organization who should be, please send them to membership@volunteermbc.org. And our entire team is doing a good search of, the credible resources to bring to you, and we are housing them all under the versus COVID submenu that you can find in our website. So come to our website and then go to the About Us main menu. When you hover over it, you will see the versus COVID-19 submenu. And with leaving this slide on the screen, Corinne, I hand over the session to you.
Thank you, Shaminda. So I just wanted to be very brief because we're out of time. I wanted to, first of all, thank you so much for being part of this session today. Thank you for, helping us think outside the box, and to make sure that we always keep screening, safe screening, front and center to avoid that risk management. I also wanted to sort of acknowledge that this is, an incredible time, one that we've never been faced with in our lifetimes, for most of us anyways. And I do want to say that out of everything, there is an opportunity. And I really would like, if nothing else, I would like everyone that even if you don't have volunteer positions available at this moment, to really start to think that what about if this happens again? Are we prepared? And this is where Volunteer NBC is trying to really leverage building the skills and what is out there in the community. What are the assets our community has? And, keep in mind that while we're, referring these volunteers, they all come to you with very, very different reasons. Some of them, as we have heard most recently, are newcomers that have just landed here, that have incredible skill sets to offer, but at the same time, they're not, they don't know where to go, but for us, it gives us an opportunity to really build those assets of what's available in the community, so that going forward, if heaven forbid this should happen again, or even if it never happens again, that we're much more able to give these volunteers with these skill sets and to better match them to your organization. So I would encourage you to think outside the box. When you look at your organization, what are some of the positions that you always wished you would have, but you cannot afford to pay for it? Somebody that may want to come in on a project management basis to look at your HR policies, especially right now, little things like that. How different ways of how you can engage youth and seniors now and going forward in virtual roles and or in person once we're finished with this COVID-19. So thank you again, everyone. We will follow up with the resources, and please stay in touch with us. Ask us any questions. We're here for you. Thank you so much. Have an awesome rest of the day. It's beautiful and sunny out there. Thank you.
Thank you, everyone.
Thank you, everyone.
Thank you.
Bye.
Bye.